So this patient's coming in for a lesion that's been present in the back of the neck for a little while now, but in the last few weeks it's got more swollen. You can see how red and inflamed that is. It's obviously draining a little bit on this side, pretty fluctuant in through here. So we're going to try and see if we can add some freezing in through here, open that up a bit and get that to express. Regrettably, once it becomes inflamed and infected like this, we can't take the membrane entirely out. We were hoping to be able to if it settled back down, but when it becomes inflamed like this, the membrane becomes very, very thin. Now, the difficulty from a freezing perspective, and we've talked about this before, is anesthetic functions on an acid-base level. So when it's inflamed like this, the lidocaine doesn't work as well. You're gonna feel a little poke here. Poke, I apologize. So what I'm trying to do here is I don't want to be into the body of the cyst itself because that causes expansion and pain. And the main nerve endings that cause the most acute pain are the superficial ones. So we want that to blanch just like that. Now, your only other alternative, you try to take away absolutely all the discomfort, is to do a large circumferential block. But again, as I mentioned before, this freezing is not comfortable. And even when you do large circumferential blocks, sometimes the infection spreads wider than you think, and it still doesn't work. This is why we're trying to find a balance to minimize the discomfort, both of the procedure as well as the actual injection of the anesthetic. Does that hurt when I do that? So I always have lots of 4x4s around, so this is just going to want to extrude lots of material. You can see it's a bit thicker there. That's why this is a cyst as opposed to an abscess. There's some keratin. It's not quite liquefied completely. Sorry. So certainly that pressure I'm putting on will be a little bit uncomfortable for him. And this is the balance we achieved where it's still a little bit uncomfortable. So you can see that material. That's keratin sitting there. So just going to use this curette to try to break down adhesions. You okay there? See how more comes out. Is that painful? So this is why, again, depending on comfort, so we can't be too aggressive with that curette. So sometimes people talk about using a basin for this. The problem with that is the drainage happens in multiple planes, and it's hard to set up a basin in such a fashion that you can get it all. Just decreasing a bit, I'm going to irrigate this. This will be a little bit cool, I apologize. So beyond cleaning it out, it also breaks down adhesions a little bit, which is what we want, obviously. And I essentially want to clean out as much of that pus as possible, always keeping in mind that pus is just dead bacteria, because I want to do a swab and see if I can capture some live bacteria and send that to the lab to sort of see what it's growing and how best to treat it. Now, because we open this, typically we don't need to put people on antibiotics, but depending on how we heal, that can change. And if we had to add something in, we want to know what we're dealing with. So certainly, if this was a staph version, we'd use basic penicillin. However, if it's MRSA or methicillin resistant or penicillin resistant staph, which is about 10 to 15% of those, then we would be changing what we'd be using for that. So once I have this relatively clean, and if you looked up the data on how to do a proper swab, you really have to clean it out quite excessively. What I've done so far is probably, I would say, the bare minimum. We're going to talk about getting a good swab of this then. Little pressure, I apologize. So essentially I just want to rub this along the wall. And again, keeping in mind that we don't want to make him too uncomfortable. And then because we can't use the curette any aggressively and it's still bleeding a bit, we're going to pack this just overnight. So this is our ribbon gauze. So just bear with me, it's a little bit uncomfortable, I apologize. So in this I'll only put on overnight. Now when we take this out tomorrow, a lot of times areas that are more likely will collapse into it. And then after that we'll just irrigate it a bit, and I will not put extra packing in because even with some freezing on board, this is uncomfortable. And studies show that there is no, for these type of cases, that it doesn't really improve healing. It just prolongs his discomfort. I'm just going to clip this here. So we'll now put a pressure dressing on this, and we'll see him tomorrow.